Welcome to Shah Medical Surgical. Today, we will talk about TURBT procedure. TURBT means transurethral resection of bladder tumor. Before going to video, please like, share and subscribe. TURBT is a surgical procedure that involves the removal of bladder tumors. It serves both diagnostic and therapeutic purposes, performed using a resectoscope. Purpose of TURBT. The primary purpose of TURBT is to diagnose bladder cancer, determine the stage and grade of the tumor, and help plan further treatment. It's often the first step in bladder cancer management. Indications. TURBT is indicated for visible bladder tumors, particularly for non-muscle invasive bladder cancer. It's sometimes used in muscle-invasive cases as well, making it essential for initial diagnosis. Preoperative preparation includes patient assessment and history, urine tests and imaging, discontinuation of anticoagulants, and obtaining informed consent. Anesthesia. The procedure can be performed under general anesthesia, depending on the patient's condition. This ensures patient comfort and facilitates surgical precision. Equipment used. Key equipment includes the resectoscope and loop electrode, a continuous flow system, camera and monitor, and suction and irrigation systems. The procedure involves inserting the resectoscope, visualizing the bladder, resecting the tumor with a loop electrode, and retrieving specimens for pathology. Step 1. Insertion of resectoscope. The resectoscope is inserted through the urethra, and the bladder is distended with fluid to begin visual inspection and identify the tumor location. Step 2. Tumor resection. The tumor is resected in small pieces using a loop electrode. Care is taken to avoid bladder perforation, ensuring complete tumor removal. Step 3. Hemostasis. Bleeding is controlled with cauterization, ensuring a clear operative field and reducing the risk of postoperative bleeding. Specimen collection. Tumor pieces are collected and sent for pathological examination to determine the cancer type and grade, critical for further treatment planning. Postoperative care includes monitoring in the recovery room, pain management, observation for complications, and ensuring patient stability. Postoperative complications. Immediate complications can include bleeding, clot retention, bladder perforation, and infection risks, requiring early identification and management. Long-term follow-up involves regular cystoscopic examinations to monitor for recurrence, additional treatments as needed, and continual patient support. TURBT for muscle-invasive cancer. TURBT is sometimes combined with other therapies for muscle-invasive cancer, including neoadjuvant chemotherapy, to reduce tumor bulk and prepare for radical treatments. TURBT outcomes. TURBT is effective for non-muscle invasive cancer, providing diagnostic and therapeutic benefits. However, recurrence is common, requiring vigilant follow-up. Benefits of TURBT. TURBT is a minimally invasive approach that preserves bladder function, offers diagnostic accuracy, and provides therapeutic efficiency. Limitations and risks. Risks include incomplete resection, possible recurrence, and complications like bleeding or perforation, necessitating an experienced surgeon. Advancements in TURBT. Advancements include improved imaging techniques, better resection tools, enhanced safety protocols, and increasing success rates. TURBT and patient quality of life. TURBT preserves normal bladder function, minimizes disruption to daily life, and is essential for patient well-being and cancer management. TURBT in clinical practice. TURBT is a standard procedure for bladder cancer, widely practiced globally, and integral in urologic oncology, forming the foundation for treatment planning. Case studies. Case studies demonstrate TURBT's effectiveness, showcasing real-life examples, patient outcomes, follow-up care, and insights into clinical application. Future directions. The future of TURBT includes innovations in surgical technology, advances in imaging and diagnostics, potential for improved outcomes, and ongoing research and development. Conclusion. In conclusion, TURBT is a cornerstone in bladder cancer care, combining diagnosis and treatment. It requires skilled surgical technique and is essential for patient management and follow-up. Thank you for watching. Please like, share and subscribe.